Hi, I'm Layla, and I'm doing my oral presentation on early intervention. So I chose this topic because I work with children on the spectrum, and I've seen kids who have had early intervention and kids who have not, and it really makes a difference. And the popular article that I chose, it actually mentions that autism experts, they tend to disagree on most things, but the one thing they can agree on is that the earlier it's diagnosed, the more likely the child is to develop normally. So the popular article that I chose is called Parents May Be Able to Lower Kids' Autism Risk. And it's basically saying that parents who have children who are at high risk of developing autism, so those children tend to have older siblings who already have autism, the parents basically need to be able to recognize the signals that their child's sending them and to respond to them accordingly. And they say that just by doing that, the parents can lead their babies down the path of normal development. They also mentioned that researchers found that with at least 6 sessions with the parents, they began noticing that the child was paying more attention, and they were also more flexible about what they were paying attention to. So they were able to pay attention to one thing and then change it completely and pay attention to another thing. So the scholarly article that they were getting their information from is called Parent Mediated Intervention versus No Intervention for Infants at High Risk of Autism. And according to the article, 20% of babies who have an older sibling with autism spectrum disorder end up developing the disorder themselves. And also that children who have siblings with autism, 20 to 30% of them end up developing some sort of communication disorder. And so basically, in the experiment, they randomly assigned 54 families to either intervention or no intervention. 28 of those families were had intervention, and then 26 of them did not. And they showed a video to the parents to help them recognize their children's unique signals and ways of communicating and help them respond to those. And the findings that their findings were that there was only a small negative effect from the treatment, and there was a large positive effect, which is good, which means that it worked for most people. And the intervention also helped parents become more non-directive, so they were less commanding. And studies have shown that parents who are more commanding toward their kids, those kids are more likely on the high risk side rather than the low risk side. And this could be because parents are having a hard time understanding what their child's trying to tell them, and that they're kind of maybe losing their patience with them. But another thing that previous studies have said is that directiveness could lead to harmful development outcomes for children. So comparing the two articles, the popular article did a good job summarizing the scholarly article and giving the basic results, which is good. But there was no mention of directiveness in the popular article, which I feel could be some really good information to tell the parents to let them know that if you're being super commanding with your child, that's not necessarily a good thing. And then Green also mentions that they need to repeat the study several times, and the popular article actually mentions that as well, which I think is good, letting the readers know that because this article was because this experiment was the first time it was ever done with infants. They was done with 7 to 10 month olds, so it's kind of good to mention. And here are my references, and thank you for watching.